Okay, guys, Unit 7 is the resident's personal living space. Now, I think it's kind of silly because I think we kind of go over this in Unit 2 when we talk about Unit 2 or 3, when we're talking about residents' losses, right? Um, we we have to realize that residents, when they come to a nursing home, might be coming from a 5 bedroom house to half a bedroom, and so they're going through all those losses, right? So we have to make their little half of their room as home like as possible. We encourage them to bring their own stuff. We encourage them to decorate the rooms, put pictures, wall hangings, things that remind them at home of their home. um, Remember the dignity and respect, right? We don't move their stuff. We don't touch their stuff without their permission. We knock before we enter. We clean up after ourselves when we're in there. Make sure we're providing privacy when we're providing care. Shut the curtains, the inside privacy curtain and the window curtain. Um, Make sure that you're keeping it clean. You're emptying the urinal, rinsing it out. You're taking smelly trash out, making the beds after you take if the resident's up. I'm telling you, it is not uncommon for the nurse manager and the DON to walk the halls and look at the residents' rooms when you have everybody at meals, just to make sure you're taking care of the residents' living space. Now, the important thing to remember too is it is their temperature they want to be at. I kid you not, when you go to clinicals, you're going to see that um, the rooms are like 85 degrees and it may be 104 outside and they still have their temperature, their room at 104 or at 85. They're cooking in there, but they're always cold. So they tend to keep their rooms a lot warmer than what we would when we're up running around sweating like crazy. They're freezing to death. So make sure you don't change their thermostats, give them blankets if they need it, make sure there's no smells, make sure there's adequate lighting. Sometimes they have a night light, or we leave the bathroom light on at night so they can see what's going on. Make sure to scan the room before you leave. Is there anything on the floor that could cause a tripping hazard? Is there anything that should be put away? Their shoes into the closet. Their walkers should be folded up to the side of the room. There should be a clear walking path. We fold up walkers and wheelchairs and put them out of the walkway. We keep them close to them if they self-transfer, but if they don't, we put them away, out of the way. Make sure that you are following procedure as far as do they need their bed all the way down towards the floor, as low as it can go, in a pad outside their bed if they're a fall risk at night. Make sure that things are clean. Make sure their bedding's clean. Their tables are wiped down. There's not leftover food on the counters or on their bedside stand. Make sure that their bedding's straight, that there's not a bunch of wrinkles. When we talk about changing bedding, we usually change it when they bathe, when we give them a bath or a shower, right? If somebody is bedridden and we do a bed bath, we call and change the sheets, we call that an occupied bed. If they're out of it and you change it while they're out of bed, it's called an unoccupied bed. Let's see. Make sure you know the names of the linens. The first sheet that goes on the bed is called your fitted sheet, right? And then usually we have what is called a lift sheet or a draw sheet. It's like a flat sheet folded in half, and we can use it to reposition people. Then if there's a waterproof pad, I'm old school, we always call them chucks, but it's a waterproof pad to keep their bed dry just in case they're incontinent. We want to make, and then a top sheet, and then usually there's a comforter or a quilt or something, and usually there's an extra blanket because, like I said, they're always cold. Um, Make sure that you use good infection control. You're wiping stuff down. You're not hugging linens. You're putting those linens and stuff that need taken out of the room in a trash bag. Always use good body mechanics. When you're making that bed, it might seem minimal and it's not going to take very long, but raise that bed. Raise that bed to working level, to your hips and or waist. I forgot to tell you that in mobility, didn't I? But always work at waist or hip level. That's about it for Unit 7. I think it's kind of silly they have a separate unit to go over that, but just remember this is their home and treat it as if it's their house and their home.